So I thought I'd begin by just telling you very generally what NIHR incubators are, and then Humera in her talk will give you a bit more information about NIHR incubators. Essentially, NIHR incubators are a virtual construct to address areas where there's a need to build research capacity on a national level. We are organized by discipline, but our incubator is not discipline specific, given the focus and aim that Viru has already mentioned. Incubators provide targeted career development support and are funded for 3 years. So we receive a small funding from NIHR to fund a project officer, as well as a small pot of money for engagement activities. Next, please. And the current round, so starting from January 2024 for the next we're almost at the end of the first year, there are 10 incubators that were funded. The 3 in light blue are existing incubators from a previous round, and then with additional 7 new incubators. And the 2 at the bottom that I've highlighted, us and pharmacy, were in response to 2 priority areas that were identified by NIHR in the call. Next, please. So our aim, as you've already heard, is to attract and inspire people from ethnic minority backgrounds to pursue a career in health and care research, and also to diversify NIHR funding panels. And the rationale behind this is from the NIHR's 2022 diversity data report. It was clear that people from ethnic minority backgrounds were less likely to be successful in getting awards, and also there was that lack of representation on funding panels. The same year, UKRI also reported, and their report also showed similar findings. So it was quite clear that there is a need to build research capacity on a national scale. Next slide, please. Our target audience is very broad. Like I said at the start, we are not discipline specific. We are open to health and care research and research related professionals from any disciplines, postgraduate researchers, and also undergraduate students from ethnic minority groups that are underrepresented in NIHR research. So we are open to everyone. Next slide, please. In terms, we've got 4 key objectives. Our first objective is to create a safe and inclusive community for us to understand what the barriers are. I mean, even I'm not sure we still need to know what the barriers are, because there's been a lot of research and extensive information in the literature, but maybe this might be barriers specific to certain groups or to NIHR. And also we want to understand what it is that we need to do to address some of those barriers. So we want to build research capacity, capability, and delivery. Secondly is to increase awareness of career pathways in health and care research, as well as understand where the pinch points might be in transitioning from one career stage to another. And today you'll be hearing about some of the opportunities that are available in the NIHR and with other funders. The third objective is we want to stimulate interest in research and health and care careers. And that's where, it's key for us to work with undergraduates and postgraduate researchers as well, to really inspire people from early on. And finally, our fourth objective is to advocate for change. Next, please. So we have 4 work streams that are aligned to these 4 objectives: communication and engagement. You've already met Vera and the team. Training and career development, where we want to co-design, co-produce a program of training and development activities. And later on in the breakout session, one of the questions is around what can we as an incubator do to support you, or what do you think we should be doing? and the talent pipeline to work with the NIHR and others who are looking to widen participation. And finally, in advocacy and policy, again, to collaborate with NIHR, other funders like we're doing today to advocate for change and to support a more inclusive and positive research culture. Next, please. So in terms of how we are organized, there's a lead and a co-lead. So Mahendra Patel is co-lead, and we've got work stream leads. You met Viru for the comms and also work members of the different work streams. We also have a steering group that is made up of people from different disciplines and backgrounds and spanning right from undergraduate through to NIHR senior investigators. We've got a range of key stakeholders so that we can make impact nationally and, more importantly, work with other people. So this is not about us doing this on our own. We are a small group. We have limited funding, but there's opportunity to work with others to advance and make change when it comes to research culture, particularly looking at racially minoritized staff. Next, please. So what's been happening? Well, you might think that, well, this is a launch event, but we have been busy right from our setup phase, which started in July last year. And so we were involved in several Black History Month webinars that has led to mentoring and coaching, as well as publicizing the activities of the incubator. We've had sessions with various funders and engaging in different activities right through from undergraduate to supporting people one-to-one with fellowship or funding applications. And we're pleased that we've had many successes in terms of people being awarded NIHR or other funding, appointments onto NIHR and UKRI funding selection panels, and also academic promotions as well. So the breadth of activity, it's been very rewarding to see what's coming through. And we've also supported two major activities. Next, please. The first I'll just highlight is our support of a research rodeo that was organized by the Birmingham Widening Access to Medical Sciences Student Society. It involved a panel session, there was a short talk that was given by Viru, poster presentations and a workshop. And through one of the workshops that was given, we've had students come forward interested in research who've had paid internship from different projects during the summer. Next, please. The other event is the West Midlands Clinical Academic Mentoring and Leadership Program that we supported. That program was funded by the Clinical Research Network. And again, there were 14 people on that program. 12 were from an ethnic minority background. All were early career researchers. This was a program that was targeted at people from underrepresented professions and also from underrepresented research settings and backgrounds. And so it was very rewarding to see the outcome of this at the celebration event. I've blurred out the photo deliberately, but that gives you some sense of participation in that event. And we've been having conversations with the NIHR about, how to diversify the mentoring program that is run by the NIHR. Next, please. So I just want to flag one of the NIHR programs. You'll hear a lot more about that NIHR programs from Humera, but this one opened yesterday. I'm particularly passionate about, undergraduates, getting them into research. And this undergraduate internship program is one opportunity for that. And in particular, I just wanted to highlight the positive impact statement that is in that guidance currently online. You can access if you're interested. This is aimed at, early career researchers becoming PIs potentially for the first time, applying for to host an intern. And you can see that Applications are welcome from those from ethnic minority backgrounds. Again, this NIHR's commitment to widening participation, and a number of other events happening will be flagged later on. Next, please. So finally, I just want to say this is a safe space. We are deliberately not recording breakout sessions or the Q&A. We want people to participate freely. We'll be respectful of one another, listen to one another, and just feel able to bring your whole self to participate today. We hope this will be an inclusive environment where everybody will feel they can share their views safely. So I hope you'll enjoy participating and contribute to today. Next, please. So thank you very much, and we look forward to working with you. Some of you may have already indicated you'd like to continue to hear from us. And if not, then please drop us an email. That is our mailbox. Would love to hear from you and talk about different ways that we can work together, whether as an individual or you're representing an organization. Thank you very much.